Welcome back to Drug Talk, everybody. In today's video, I want to quickly go over 3 things you should be aware of before using Indomethacin. Number 1, when you start using Indomethacin, you may experience neurologic side effects. A small number of patients using this medication may experience somnolence. Somnolence is a state of drowsiness or a strong desire to fall asleep. This seems to occur in about 1 to 3% of patients. There is also a risk of experiencing dizziness while using Indomethacin. 3 to 9% of patients will experience this side effect. Vertigo, which is a sensation that a person experiences when they feel like they're moving or objects around them are moving, happen 1 to 3% of the time. The most common neurologic side effect experienced with patients using Indomethacin seems to be headache. It comes in right around 11 to 16%. Many of these side effects that I mentioned will go away after some time on the medication when your body gets used to the medication. However, if some of these side effects persist and become troublesome, be sure to have a conversation with your prescriber so they can help you make a plan on how to move your treatment forward. Number 2, gastrointestinal side effects are a possibility with Indomethacin. Of all the GI side effects, the 2 most common are indigestion and nausea. Indigestion seems to happen at a rate of 1 to 9%, and nausea seems to happen around 3 to 9% of the time. Constipation and diarrhea are less common. They seem to happen in 1 to 3% of patients. Abdominal pain is often discussed when a pharmacist is counseling a patient on Indomethacin and other NSAIDs. However, this only happens less than 3% of the time. We often discuss this side effect because it's well known that you can avoid or at least decrease the abdominal pain if you do your best not to take Indomethacin on an empty stomach. Rather, have a meal before taking your dose. And number 3, there are black box warnings associated with Indomethacin. These warnings are really meant to address all medications in the class of NSAIDs or non-steroidal anti-inflammatory drugs, which Indomethacin belongs. Indomethacin has increased the risk of serious thrombotic events such as myocardial infarction or heart attack, as well as stroke, and in some cases these can be fatal. The risk may occur early in treatment and can increase with duration of use. NSAIDs, again non-steroidal anti-inflammatory drugs, have also been noted to cause an increased risk of serious gastrointestinal events such as gastrointestinal bleeding, ulceration, or perforation. If these were to occur, it would typically occur in the stomach or the intestines. These events can occur any time during use, and they can happen with or without warning signs. Elderly patients and patients with a history of peptic ulcer disease or gastrointestinal bleeding would be at an increased risk of experiencing these serious events. And that's all we're going to discuss today with Indomethacin, but before you take off, I wanted to let you know that you can pick up a copy of my book, The 5th Episode, Inside the Manic Mind, by clicking on the link in the description of this video. Take care.